I think something really interesting is going on here. I think GPs were pretty much the most trusted people in local communities. Be that in a city, a village, a town, the GP, the family GP, the person that came to visit when, somebody at home was seriously ill. And I felt sorry for them, actually, because they couldn't, go and play tennis or go for a drink without someone saying, "Oh, doc, I've just got this slight problem." But I always think being a politician or being a GP, you can never escape from. But they've gone from being some of the most trusted people. There is now a breakdown in that trust. I think the fact they won't see people face to face or not enough has led to people starting to ask questions. And now, Paul, on the verge potentially of a strike, not doing themselves much good, are they?
No, I have to say, as a trade unionist, I would find it quite a difficult strike to support. It's a nonsense, the idea that a remote consultation is anywhere near as good as a face-to-face consultation. I don't think you need to be a medical expert to know that that's clearly a nonsense. Doctors may miss all sorts of things if they're not able physically to examine the patient in front of them. And a lot of elderly people, for example, are not particularly au fait with Zoom or other online platforms. They're not great at uploading a JPEG of the lesion on their skin or whatever it is that they've got. So I think people are uncomfortable with it. So no, I would find it difficult to support. On your broader point, GPs certainly were figures of authority, but figures of respect as well. But I don't just think that's about GPs, Nigel. I think there's a sort of general slinking away, if you like, of public authority figures who were once there and very present in local communities. You look at the police, for example. Very rare now you see police on the streets. You don't see people on checkouts as much. It's self-service checkout now. You don't see park keepers, bus conductors.
Or the vicar.
And
who, again, was a very central part.
Kind of 1950s, let's romanticise it.
No, but it's true.
The reality is, people who were once upon a time a real presence are now not there anymore. And I think that's a sign of the sort of society we live in, to be honest.
Well, joining us now is GP Dr. Lawrence Jerlis from Same Day Doctor. Lawrence, one of the arguments I've been given as to why actually online consultations work is the argument is that a lot of people who've got busy lives, they're running businesses or they're travelling, that there are some people who actually prefer to have online consultations.
Exactly so, Nigel. One of the mistakes of this argument that I think the government has misjudged is this binary division that online consultations are bad and face-to-face are good. That's not true. Every day I have patients who want an online consultation. It's convenient. I think the problem is a lot of GPs misuse the system. I know lots of GPs who work very hard, but I think they and their receptionists in particular didn't use the technology properly. So I'll give you a couple of examples. I've seen a man who had 3 online consultations for urinary symptoms, given 3 different antibiotics. When he came into us, he actually had a kidney stone, not an infection. We saw another man who had 5 online consultations with his GP, 5. And again, when he came in to see a GP eventually, she had to refer him to a specialist. Now, I think if someone's had 2 or 3 online consultations for the same condition, they must have face-to-face. But I think it's wrong to say that everyone who demands a face-to-face consultation must have them. And I don't think the government really with plans to name and shame. I don't think the GPs should strike. I think GPs, like the police, should not be allowed to strike. I think doctors withdrawing their labour is a fundamental abrogation of their responsibility and the Hippocratic Oath, quite frankly. I don't think they'll strike. They've got no public sympathy at the moment because some GPs and some practices have not used the technology properly and have used it as a barrier between them and their patients. I'm disappointed with the BMA. I used to be a member of it. It's not a learned medical body. It's a trade union. I read their magazine, the BMJ, every week, and there has been no hint of an apology for the huge number of people. And you only have to read social media to see how many people have been let down by their GPs. There has been no hint of any apology from the BMA, and I think they should do that. And I think the two sides we should knock their heads together And we should say, use the technology, use it properly. We're not going to name and shame, and come on, let's all get back to work and start treating patients and sorting out this waiting list.
Made that point that for some people the online consultation works. The argument comes those that want face-to-face and can't get it, and it's about getting that balance right. But the other thing that the BMA have been pushing hard this week, and many others in the medical profession, is urging the government to move to Plan B, and to move to Plan B quickly. And of course, Plan B would be mandatory face masks. Plan B would also be vaccine passports. Are the BMA and others overplaying their hand, or are they right to be concerned?
They're not right. And again, I don't understand why people within the NHS, they all protect the NHS. You know, people have got busy lives, have got to get back to work. If you look at the case numbers, it's mainly among older teenage school children. Fortunately, we're on half term. We're going to see the numbers drop. The number of people in hospital beds with COVID is still very low, fewer than the 5% of hospital beds taken up by COVID patients. I don't see any need to move to Plan B. I'm disappointed that the GPs and the NHS Confederation are calling for more lockdown. Bear in mind, more lockdown means social distancing at your GP. So that's going to stop people going into the GP practice anyway. And I'm a bit tired of people who have become drunk with power telling other people what to do. The NHS is there to serve the patients, not to tell patients how to live their lives. And we're going to have a winter crisis. We always have a winter crisis, with or without COVID. But I don't think it's up to the NHS Confederation to tell the government to impose more of a lockdown, because we've just got to get on with it and do our best.
Lawrence, that was as absolutely clear as a bell, and we thank you for joining us here on GB News this morning. Thank you very much. Well, that was really rather wonderful, wasn't it? I mean, he made the point very clearly that only 5% of hospital beds are currently being taken up with COVID patients. So infection rates are high, running at between 45 and 50,000 a day, but not that many people are getting seriously ill.
And this was the point of the vaccine all along, wasn't it? I mean, the point of getting vaccinated was so that you could protect yourself, not necessarily from contracting COVID, but from getting in any way seriously ill from it and ending up in hospital. And we're seeing that. We are seeing the vaccine is working. You know, there's now this big push for the booster jabs so people can get an additional layer of protection, particularly focusing around the more vulnerable and those who are over the age of 50 at the moment. And I would encourage people to take up that booster jab if they get the opportunity to do so. But certainly, I don't feel like now is the time to be introducing vaccine passports and mandatory mask wearing.
No. The truth is, I think we have to learn to live with it. We're at a point now. I think another lockdown would be an absolute non-starter. I think if you look at the problems, whatever people's view on it, it's certainly stored up a lot of problems in terms of people's health, the economy, etc. I don't think there's a will amongst the public, particularly, to go into another lockdown. There are different variants, and we've seen different variants of the virus. There may be different variants in the future that the vaccine may be slightly less effective at dealing with. Do we say that every time we discover a new variant, that actually we need to go into a lockdown until we've got a better vaccine that can address that variant? You can't go on, I don't think, with this situation where there's uncertainty, there's a suggestion every few months we might be entering another lockdown. So I suspect the government probably knows that, and that's why I think it's keen to get this booster rolled out as quickly as possible so it doesn't confront.
I think their behavioural scientists will say if we attempt lockdown again, there could be quite a big rebellion against it. Arlene, good morning. Extraordinary, isn't it, that we've got the GPs threatening a strike? Just wonder what your take on that was.
To be with you again. It wasn't just around the fact of face-to-face that I noticed that they were complaining about. It was also the fact that they didn't want to have pay transparency for those who were earning over £150,000. And I thought that was amazing, because these people are public servants. And if you're a public servant, then you have to take the transparency that goes with being a public servant, as Deanna and yourself will know, Nigel. That's what we do. And I think it's amazing that is quoted to be as Deanna said at the beginning, one of the worst aspects of the 9-point plan put forward by Sajid Javid. I don't think it's a bad aspect at all. People should be open to pay transparency. So I think there is a real problem now developing post-COVID in relation to a number of professions. They have found that they can do things differently during COVID, and they want to continue to do that. And I think they have to realise that it is a public right to have access to their GP because the GPs are publicly paid. I was just reflecting on Paul's point about respect for those people in professions. I mean, when I was growing up, everybody respected their police officers, their solicitors, dare I say it as well, their GPs, and now that public respect has all but disappeared. And I think that's something that we should regret, because we should look up to those people who provide those services. But I have to say the GPs are not helping themselves in the way in which they're going around this discussion.
I certainly know from my own inbox, and I'm sure you've had probably the same, Nigel, people are really, really angry. You know, they want an appointment, they want to be able to see a GP, mainly elderly people, as you rightly highlighted earlier, Paul, who might not feel comfortable being able to set up Zoom and do something digitally. Yeah. It's great. I mean, I've used digital appointments when I need prescriptions and you do it on your lunch break or whatever, and it can be really handy. But as Lawrence, our doctor earlier, just highlighted, lack of face-to-face appointments really is letting people down and is leading to conditions worsening before they're actually being seen to.
And this lack of respect that I talked about at the very beginning.
And this thing that many practices employ now, where you have to phone up at 8 o'clock in the morning to see if you can get an appointment for the day, and if you can't get an appointment, you have to call the next day, which is impossible for some people because they have to commute at that particular time.
And even trying to get through on the phone, it's 100 calls before you actually get the text.
And you know, I remember as a kid, I don't think there was even an appointment system. You went to your GP, your parents would take you to your GP, you'd get there, okay, the waiting room might be fairly full, but you know what your wait is. You might be there an hour or so before you get seen, and it was dealt with. And GPs then, they would do home visits. They would often work at weekends and in the evening and so on. So it seems to me to be a fundamentally different system now, not one that is actually as good.
Dare I say it, but a country whose immigration policy lets the population go up by 7 million in 20 years, what do we expect?
But I don't think that explains the position of GPs at the moment in terms of remote consultations.
No, it explains the ratio of GPs.
I certainly think there's a problem in terms of ratio of patients to GPs, which is clearly...
Compared with Germany, say.
Which is why we have this recruitment drive, though, isn't it? To get a lot more GPs actually on the book so we can deliver more GPs appointments.
I think the problem is often, though, because of the medical training that's involved, the time it takes for that to actually filter through to the front line is often years and years, and that's, what do we do in the meantime to fill that gap,
I mean, I do feel that the bureaucracy that is there for a lot of our GPs does need to be challenged. And I think that's one of the points that the BMA is making, that there needs to be a look at the level of bureaucracy for them. And I know we're going to be discussing assisted dying later on in the programme, but that's one of the areas that I'm sure that they will feel very strongly about as well, how they can deal with diagnosis for those people who are terminally ill in a way that allows people to move in that particular direction. So that's a huge issue, and I know we'll talk about it later, but the bureaucracy point, I think, is a point that government needs to look at to try and ease the burden on our GPs.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.